I remember when I first got this job, the first meeting I went to a few weeks later was the Retina Society, and I remember walking down the hall into the meeting, and there was Arch waiting for me at the door with a huge welcoming smile on his face. And actually that was my first big welcome to Wills Eye Hospital.
So whether you're in a bad day or a good day, you want to meet somebody like Arch because he'll come out with that smile, and no matter how bad of a day you had, you feel good about yourself.
Arch had a tremendous zest for life. He would light up a room when he came in. He was always in good spirits. He had this terrific laugh, this belly laugh that was just really made you feel good, wanted to be around him.
Obviously, he was an amazing husband to Judy, dedicated father to David and Kelly, and a very skilled surgeon. But you know, he was also someone who enjoyed life immensely. He was an explorer.
He taught me not just about you know, being a good retina doctor, but also taught me about life and kids, and you know, we chatted a lot about our children. So he was very proud of his daughter Kelly and David, and we would chat about colleges and university, and he was so proud.
Arch was a very good surgeon, and we were doing a case, and he was doing a lot of it. And what was interesting was that the resident on the case was Judy Mielek, later to become Judy Mielek McNamara. Judy, of course, is very hardworking, and she is simply the most honest person in the world. If you want the truth about anything, Judy will give it to you.
For me, besides obviously a very, very good friend, he was my sounding board in the practice. I spend a fair amount of time dealing with administrative stuff, and issues come up, whatever it might be. And if I wanted to know, you know, what's right here, not what's financially smart or, you know, what might work out in the short run, what's the right thing to do? Arch would be my guy.
But Arch did something that made a huge impact, more than any of us will ever do in our careers, and that's the advancement of the care of retinopathy of prematurity. Up until the time Arch took an interest, a research interest in this, care of ROP was rather crude. We used to do cryotherapy in the NICUs, which was an involved procedure, definitely helped with outcomes, but had lots of side effects. It was difficult to do, difficult for the doctor, difficult for the baby undergoing the treatment in particular. We were able to get lasers that were smaller, portable, based on solid-state technology. So Arch had the idea of taking these right into the NICU and utilizing laser as a substitute for cryo, and it turned out to be a much better treatment.
One of the truly remarkable things about the way this gift from the McNamara and Mielek families is structured is that it included not only the bricks and mortar piece for building a state-of-the-art education center, but it also creates an endowment for allowing that center to flourish programmatically.
I think that the dedication of the J. Arch McNamara, MD, Medical Education Center is something that he would be extremely happy with. When Judy called me, it was an amazing idea, and I know Arch would be behind it 100%. It's a living tribute to his memory and his dedication to wills and surgery and education. And I cannot think of a better way to honor his memory.